Alzheimer's disease. Alzheimer's is basically a progressive mental deterioration, so down the road it causes confusion and memory loss. Therapeutic effects of drugs used for Alzheimer's disease include the following. For cholinergic drugs, they increase anticholinesterase activity, which in turn increases acetylcholine in the brain. NMDA receptor antagonists or N-methyl D-aspartate receptor antagonists. In Alzheimer's, the cells can produce too much glutamate, which results in excessive calcium, which can speed nerve damage. NMDA receptor antagonists prevents binding of glutamate while still allowing important signals to flow between the cells. Indications for these drugs include treating and slowing down the progression of Alzheimer's dementia. Precautions and contraindications include cardiac dysrhythmias, hyperthyroidism, renal and hepatic impairment, seizure disorders, and Parkinson's disease. Side effects include cholinergic effects, which include decrease in heart rate, decrease in blood pressure, nausea, vomiting, and increase in secretions. Nursing actions include assessment for therapeutic and side effects. Additional nursing actions include avoiding anticholinergic agents whenever possible because it reverses the drug effect. Examples of drugs for Alzheimer's include Aricept or donepezil and Namenda or memantine. Donepezil is a cholinergic drug, while memantine is an NMDA receptor antagonist. Psychotic states. Psychotic states is described as severe disorder that impairs mental function wherein the patient is unable to perform ADLs. Hallmark is losing contact with reality. Examples of these psychotic states include schizophrenia and induced psychosis. So sometimes it's from drugs, depression, or other mental disorders. Therapeutic effects of drugs used for psychotic states include blocking dopamine receptors. Therapeutic effects of drugs used for psychotic states include blocking dopamine receptors. So this causes a decrease in dopamine concentration in the central nervous system of areas of emotion, cognitive function, motor function, therefore resulting in tranquilizing effect or calming effect. So these drugs result in chemical control of the symptoms. Ideally, when choosing or selecting the agent, the providers need to choose the drug that can treat a condition with the least amount of side effects. Indications for use of these drugs include schizophrenia, induced psychosis, autism, extreme manic phase of bipolar disorder, disorders of movement such as Tourette's and Parkinson's, and as well as other medical conditions such as intractable hiccups. Precautions and contraindications include CNS depression and renal or liver dysfunction. Side effects include extrapyramidal side effects or EPS, tardive dyskinesia or a type of extrapyramidal side effects, neuroleptic syndrome, cardiovascular or blood pressure and cardiac dysrhythmias, agranulocytosis, and hemolytic anemia. Extrapyramidal side effects affect the pyramidal portions of the brain, so the symptoms include various motion disorders such as tremors and muscle twitching. So as mentioned earlier, a type of extrapyramidal side effect is tardive dyskinesia. Tardive dyskinesia is an abnormal involuntary movement of some muscles causing muscle tension, or repetitive involuntary movements of usually voluntary muscles. Neuroleptic syndrome or neuroleptic malignant syndrome is quite uncommon. So this is a serious adverse effect of antipsychotic drugs which can cause fever, cardiovascular instability, myoglobinemia, which is the presence of muscle breakdown proteins in the blood. Agranulocytosis is a drug-induced dangerous low levels of white blood cells, more specifically low levels of neutrophils. Hemolytic anemia is the destruction of red blood cells causing low numbers of red blood cells. Nursing actions include assessing for both therapeutic effects and side effects, patient and family education regarding the disorder, drug information, and facilitating counseling, as well as always ensuring safety. Examples of drugs to treat psychotic disorders include conventional or typical first-generation drugs. The drugs to remember under this class is Haldol or haloperidol, thorazine or chlorpromazine. Haloperidol or Haldol is an antipsychotic and the pharm class is butyrophenones. Thorazine or chlorpromazine, the therapeutic class is antipsychotic and the pharmacologic class is phenothiazine. Atypical or second-generation drugs include Abilify or aripiprazole, Risperdal or risperidone. Abilify or aripiprazole, the therapeutic class is antipsychotic and mood stabilizer. The pharm class is serotonin dopamine activity modulator. Although Abilify or aripiprazole is often prescribed for patients with schizophrenia or bipolar disorder, this is also prescribed at times for patients with severe depression. Risperdal or risperidone, the therapeutic class of this drug is antipsychotic and mood stabilizer. The pharmacologic class of this medication is benzoxazole.